Good afternoon, everyone. It's a real honour and a privilege to be here with so many great colleagues that I know, but I have to say that Helen, sharing a platform with yourself is one of the greatest privileges I've had in some time, so that was amazing listening to you speak earlier. Colleagues, I'm going to talk to you about what I would like to describe as a road to the rights-based approach to diagnosis, and within the context of that, talk about how national dementia strategies have influenced diagnosis. But I'm not going to talk to you about the technical numbers and issues of that nature. I want to talk to you about the process that we went through in Scotland to reach a point where I think we've seen the tide and the whole construct of dementia change, and change away from a medically orientated model towards a very much citizenship, rights-based approach to dementia. And colleagues, I stand here in front of you in the knowledge that there's actually lots of people in this room and literally thousands of people back in Scotland that have been part of this process. So I merely tell the story. I think the credit for all this goes to the partnership that we've had in Scotland for many years now, and I think that's the right way to describe it. A true, proper partnership that's led to us achieving where I think we are. So, you saw this a moment ago. It's great. That's what we want. This, to me, is the manifestation of a rights-based approach to supporting people after a diagnosis of dementia. I won't go through every bit of detail with this. As I go through the presentation, you'll understand why these things are important. But the most important thing I would say about this model is that what we are trying to do is to ensure that people after a diagnosis don't get put into a systematic care pathway, don't get a short amount of support or a varied amount of support. They have a real strong level of support from very skilled practitioners that can take them through these 5 areas which have been identified by people with dementia and their families as being crucially important after diagnosis. So we call this the 5-pillar model. But I want to go back a little bit to explain how we reached this point. Because for those of you here who are constructing policy, or who are thinking about influencing policy, or who are campaigning for better policy, I really believe there's a very important story to be told. And don't look simply at the model and think that's the answer. There's a lot of things that have to come together before you reach this point. And I think the national dementia strategies, if they're in any sort of construction at the moment, you've got to think carefully about how you influence them in order to get to this type of model. So prior to 2007, I would have described Scotland's dementia platform as probably more dominated by a very medical model. And that both was in terms of policy and in terms of practice. No question that drugs probably were the main driver, and diagnosis rates were poor. Variable post-diagnostic support and variable family and carer support. And in 2007, we were incredibly fortunate that the Scottish Government made dementia a priority. And alongside that, the Scottish Government put in place a HEAT target, as we would describe it, and that's a health, equality and access to treatment target. And targets are questionable on all sorts of fronts, but from our perspective, it was a bit of a game changer in terms of the diagnosis rates in Scotland. And it built on that prioritisation of dementia. And the target was quickly exceeded. And I think the most important thing from my perspective that the target did was that it got everyone thinking and talking about diagnosis, but it started to set the scene and the conditions for change, and it opened up the door to what's next in terms of post-diagnostic support. As many people know, there's no point talking about diagnosis without talking about post-diagnostic support. So that was an important part to the work in Scotland. This thing here, some of you may have seen, but for me, this is probably one of the most fundamental and really important change agents that we had, starting to put a framework round about descriptions of people's rights. And we created this in partnership with the cross-party group in Scotland, but extensively involving people with dementia and their families. And we developed what we called this Charter of Rights. So we actually put on the table some clarity around about the types of rights that we were talking about. And we made a big shift, in my view, away from thinking about, people with dementia as a diagnosis with an illness, to thinking about citizens who have got a diagnosis of dementia now, but have also got the rights to choice, power and control, and to engagement and to participation. And that process was a fundamental game changer, in my view, because what that allowed us to do was it allowed us to use the Charter of Rights to influence every other aspect of policy, evolution and development. And I'll come back to talk a little bit more about that in a moment. But alongside that, we were quite lucky because we had managed to secure a little bit of money from Scottish Government in an unusual way, because it was pretty open. We were exploring, without having any real details or clarity, what is good post-diagnostic support? What does that really look like? And we ran a practice-based research project for 18 months, testing and trialling and thinking and just looking at what is good quality post-diagnostic support, what works. And what we learned were some of the really important things that we now have within the 5-pillar model. So the first thing that we really started to understand was just how much people needed to maintain choice, power, control, and crucially, hope. We learned that we could really use lots of the work that had been done in terms of person-centred practice to really develop new ways of planning the future for individuals, to really empower people. We learned how to work creatively to help people control and design their own support. And we also learned that people value very much other people with dementia as peers and friends, and that was a really important part of our findings within that. We learned that we must maintain the personal, natural supports and indeed work within the whole ecosystem that individual has at that point of diagnosis. Keep everything intact for as long as possible and ensure that the person and their family, their friends and their communities are all part and parcel of the support structure and system that we created. We really learned that we had to shift away from this idea of patients to citizens, and from medical towards biopsychosocial models of understanding. And from all of that, we then developed the 5-pillar model as you've heard it described. But some other things were happening. Again, some of this has been luck, some of it's been really strong strategy and opportunity, but it comes together in 2010 when the government starts to put together the first national dementia strategy for Scotland. And within that, 2 key areas that were very important to the majority of people who were living with dementia, and indeed certainly Alzheimer Scotland, were prioritised. And that's the post-diagnostic support and acute hospital care. But crucially, what happens is that the Charter of Rights is placed at the front and on the face of the National Dementia Strategy. And that creates really quite important conditions for change, because every policy that then came from that strategy has at the front of it the Charter of Rights and this rights-based approach. And what happened in the creation of the strategy, which I think the Scottish Government deserve a lot of credit for, was that the power base shifted. Before 2007, it would have been a group of doctors that would have wrote a mental health strategy and put dementia into it somewhere. We now had a strategy that was written and constructed and driven by people with dementia and their families and carers, and by a broad range of stakeholders thinking about rights and thinking about things from a different perspective and thinking about what's possible and how we might change the construct as we went through that. Following on from that, I think even with the strategy, the truth is it was still difficult to get everyone to buy in to good quality, timely, early diagnosis and good quality post-diagnostic support. And we were, again, very fortunate when Nicola Sturgeon, who at that time was the Cabinet Secretary of Health and is now our First Minister, made which we regard as a world-leading commitment that every person diagnosed should get a minimum of 1 year's post-diagnostic support using the approaches that we are describing here. And that set the scene for a huge increase in the number of people who were employed as link workers across Scotland. And as part of this process, we were evolving our thinking. We're all working together. It's not just Alzheimer Scotland. We're all working together to try and understand how we can keep this manifestation of a rights-based approach in terms of post-diagnostic evolving. And a lot of that comes down into this role of the link worker. And I've put this list together because these are the things that link workers should be good at. These are the things that link workers need to understand. And look at them. They need to be good at helping people with choice, with power, control, inclusion, citizenship, creative, empowering, building assets and building strengths. Guarantee you, if you look across a lot of areas, you won't see these as a skill set that's required to support people with dementia. You'll still see a very medically driven, very much orientated towards symptoms and symptom understanding and management. That's a crucially important part of it, but if you don't have these, as you build your strategies and you start to develop post-diagnostic support, if you don't have a skill set like that, with a workforce like that, you're going to miss the opportunity. So, within Alzheimer Scotland, there are some other link workers throughout Scotland. We have 65 link workers who support people with dementia. They've got a year to do it. And this is a really important period of time. But what they're doing is helping that person during that year prepare for the future and build resilience, build capacity, build their strengths, build their assets. And we know by doing that, and we know now, because so many people have experienced it, that it is transformational for people to experience good quality post-diagnostic support, and that the confidence, the strength, the hope, the sense of self and the sense of well-being that they take into the following years is quite remarkable. And from our perspective, 3,000 is a good start. We could probably be doing with tripling that, but I think we've made huge progress and we would like to evolve it. So I'll just finish by saying where we are now, in my opinion, is that we've completely shifted the paradigm. The power base and the practice base has moved. The prevailing construct, and this is evidential in every bit of public policy and in the knowledge and skills frameworks that are all developed in Scotland, is a rights-based model. The 5 Pillar has played a big part in that, has played a key role within it. It's meant the rights of citizens living with dementia are at the heart of the support. It's delivered inclusion, and it builds on individual strengths and individual assets. It works at a deep, deep individual and family and community level, building all the time resilience and helping people to self-manage in an empowering and creative way. And because of all of that, it drives better diagnosis rates. Because what we've done is that we've absolutely begun to convince people there is so much you can do about dementia and challenge the myth that there's nothing that you can do about dementia. But we've done it in a way that I hope reflects at its core this concept of citizenship with strength, with ability, with power, and with choice, and with control. And the link workers can facilitate that process. And at the end of that year, the person moves forward with hope and ability, and I hope that they can actually start to lead as good a quality of life as a citizen, rather than someone who's got a diagnosis of dementia. So colleagues, thank you very much. It's been a pleasure speaking to you, and appreciate that.